Hi guys, welcome to my channel. My name is Olivia. So today I'm going to talk about my bladder voiding technique, which is the Mitrofanoff, also called appendicovesicotomy. I think that's more the medical term for it. There's just been a lot of questions that have been popping up about this lately, so I thought I would make a video about it. I guess it is important to find the appropriate bladder management technique after your injury. Bladder health is important to have to prevent complications later on in life. And there's actually like a great website, which I link in the description below, that talks a lot about how the bladder behaves after your injury, different voiding techniques, etc. And what I'm going to cover in this video is what it is exactly, its benefits, the time I'm suggesting to wait before you get something like that done, questions you should be asking prior to getting the surgery, and then also the recovery process and what's expected. And then at the end, I'll give you a little bit of my my bladder journey. Out of everything that's kind of happened with the injury, my bladder's been the most stubborn and the most challenging to be figuring out. So yeah, I'll give you a little bit of what I've gone through with it. Okay, so let's get started. So basically what is the Mitrofanoff? It's a bladder diversion technique where they basically take a piece of your bowels to make a link between your bladder and your tummy. So mine's just right here, basically. And you end up putting an intermittent catheter in there, and this is just the way that you void. So it is a pretty massive surgery that you're gonna go through, and a little bit of a process to figuring out like your bladder kind of behavior prior to getting something like that. A lot of the time that surgery is also done with like a bladder augmentation. And again, it depends on like your bladder voiding capacity after the injury. So its benefits. So the surgery was pretty massive, and the recovery process was actually kind of brutal for me. But its benefits just completely outweigh everything that I've gone through, basically. It's just added so much more independence to my life. It's also like lowered like my frequency of like UTIs. It's better for your bladder health, like less chance of bladder cancer and stuff. And also to pee, I just have a bottle that I carry with me, and I just can pee on the go basically anywhere. I just pee into a bottle and then void the content of it whenever I can. So it's just like super easy to go pee. I don't really have to find a public bathroom anymore. So that's been like a massive advantage to that. And I have another video actually where I show how I void from my Mitrofanoff. If you want to take a look at that, I'll put it in one of the cards, and then I'll put it in the description below as well. So the time that I'm suggesting you to wait would be about 1.5 to 2 years. At least after your injury. And the reason behind that is that you kind of have to figure out what your bladder behavior is going to be like. So you'll be working with like your urologist, going through like your dynamics to figure out how your bladder kind of behaves, what kind of medication you're going to have to be on to not get incontinence or Botox, and what are you voiding volumes as well. So are you going to need an augmentation with the surgery? Like a lot of the times that surgery is done with an augment. And with the augmentation too, like you have to think like after the surgery, you're gonna have to do like bladder like flushing techniques. So as a quad, it's just like a lot more like equipment basically that you have to use to do bladder flushing every day, couple days, every week. It depends on like how much mucus your tissue is kind of producing. But it's also like hard to do with minimal hand function. So yeah, it's always good to kind of figure out how your bladder behaves, and that takes time. It's like trial and error with like medication, Botox, seeing what works for you. Do you have a really spastic bladder, or do you have a bladder that is just kind of fine? Does your bladder give you a signal when you have to go pee, or do you have to like pee every certain hours so like your urine doesn't back up into your kidneys? Like there's just a lot of stuff to kind of figure out prior to going and getting this surgery done. So I guess like questions to basically be asking prior to getting this surgery. I actually learned this from one of the Facebook group that I'm on called Spinal Cord Injury peer support, USA, I think it's worldwide now. There's like 16,000 people on it, and learned a lot by asking questions about that. And I'll put that the link below to connect to that. But anyways, I would ask basically where you want your stoma. So if your appendix or the piece of your bowels that they're using is too short, you don't want it to be too low so that you can't cath. Like normally it's supposed to go through your belly button. Mine was too short to do that, so it's just like on the side. I can show you. It's just on the side here. So it's like making sure that you give your urologist or the person that's doing the surgery the level of where you would want the stoma to be, like not lower than a certain area, so you're able to cath. And then another one, so for me, again, from somebody that previously got this, like they ended up putting like staples with her scarring and stuff like that, which is normally a safer way of doing it. But for me, I just asked for stitches, like dissolvable stitches, just because I didn't want as big of a scar. But with that, it's got more easier way of like ripping and stuff like that. So you just have to be like extra careful when you're recovering, not to, really like do breast movement that would like rip everything open basically. So there's just like a higher risk with that technique, but the scarring is just not as big. Going over the recovery process. So it is a pretty massive surgery that you're gonna go through, and the recovery process is definitely a little bit brutal. It was for me anyways. There's just like a lot of things that you're not gonna be able to do. You have to minimize doing if you don't wanna like open up your wound, if you wanna recover properly and stuff like that. So it's definitely something that you have to kind of plan your care around prior to the surgery, just so you can, once you actually go home, you have something that's kind of set up to help you with your care. Especially as a quadriplegic where you don't have your hand function to do a lot of things. You can't really transfer for about a month depending on how fast you kind of recover. And it's also like just doing any movement that's gonna like put some pressure in that area and could open things up. So you just have to kind of minimize doing any of that. You're also gonna be like hooked up to a leg bag as well as a bag on your tummy to keep the hole open. And then after about a month, they'll remove both bags and you'll start cathing by yourself and stuff. And another thing that is important to do, like for me, I had a home care nurse that was coming in to do some wound care. Like you have to do professional wound care to kind of come in because it's a pretty big incision. Like they opened me up like to above my belly button all the way down to my pubic bone basically. So it's it's pretty massive. So a little bit about my bladder journey after the injury. So my bladder was definitely the most difficult thing to deal with post-injury. It was just so stubborn, and it just took a while to kind of figure things out. So I actually was reacting to the Foley catheter when I had like my leg bag and stuff like that. So like having that thing inside me all the time, like I would get this reflexic. Not so much like my blood pressure would go up, but I would be like getting goosebumps and sweating all the time. But it's more like a cold sweat, not like a regular sweat that you just get when you're doing some exercise or something like that. So it made things really difficult, especially in the winter. Like I was always cold. I couldn't be outside for that long because I'd be sweating constantly and stuff like that. So I was like looking at different bladder avoiding techniques to prevent that from happening. Thought about doing the suprapubic, but I don't know, it didn't feel right when I went to actually get it, when I was about to get it done. And then found out about the Mitrofanoff and talked to other people, and that was kind of like the way of doing it. And then in the process, so after it was like figuring out, like your bladder's been emptying into a bag all the time. So then it was like figuring out how your bladder was going to react if you started to fill it up, and what medication you needed to be on, whether you needed to get Botox, whether I needed to get the augmentation as well prior to with the surgery, or where my bladder volume is going to be high enough that I wasn't going to need to do that. So with that, I ended up having like a flip and flow valve. So it's basically you're using your bladder as a bag, and then you have like a valve a thing that attaches to the Foley catheter that has a valve that you open up when you have to go pee, and you can just go to the bathroom and go pee that way. So that's, I guess, another way of voiding. If you don't want to get a massive surgery like that and you don't want to be using a bag, you could have a flip and flow valve to figure out, and then you can figure out your bladder behavior that way as well. So seeing like what kind of volumes you kind of holding on, working with your urologist to get your urodynamics test to know what your bladder behavior is when it's filling up, like whether you actually like gonna get a cue that you have to go to the bathroom, or whether your bladder fills up and backs up into your kidneys and you need to like go and void every certain hour so that doesn't happen. So I got this surgery done about 3 years after my injury, and it's honestly been the best thing that's ever happened to me. Like I actually like my voiding technique better now than before my injury, because I don't have to find a bathroom. I just pee into a bottle, I take the medication that I need, and I take like Myrbetrix, which has like lower, for me I had like lower side effects, and then my blood is really spastic, so I also get like Botox to basically keep my bladder from being incontinent and from spasming. And the surgery recovery was actually pretty brutal. So I was in the hospital for over a week after the surgery, and like my whole because they go into your digestive system to take a piece of your bowel. So for me it was just the appendix, but other people, they'll take like a piece of your bowel if you don't have your appendix and stuff, to make the connection, or to do the augment as well. So my whole system basically froze up. So for a week I basically didn't go to the bathroom to do number 2, and I was on like a liquid diet at one point, and was just like puking. It was just horrible. I was my whole system froze up basically, and I had to wait until everything started to move again to be able to like go home and do whatever I needed to do. So it was not a pleasant experience, but the benefits that I have from it outweigh all of that. Like I don't want to say barely even remember, because I do remember it. It sucked. But then, going home, it's just like you kind of have to be ready with your care to kind of be there, because you can't really do any efforts like transferring or doing anything that's going to like put strain on that kind of area. So like your scar kind of opens up, like your incision opens up. So it's being ready with your care that's going to be there to basically transfer you out of bed, transfer you in bed, transfer you on your commode. If you have a lift, then great. Otherwise, it's like doing like the quad lift, where you like go underneath the knees or underneath the arm to put somebody on a chair and stuff like that. So you just have to be prepared for that, and then also being prepared with somebody to do professional like wound care. So like a nurse that would come in every couple days to check that nothing's infected, to do the wound care that it needs, to patch things up, and to take a look that everything's healing properly. And that kind of went on for about a month, and then after a month you get your other like appointment to go take everything that you have, like that tube that you have in and everything that you have in there out, and then you start cathing on your own, and you're good to go. And so definitely a big surgery. The recovery process for me was brutal, but I'll say it again and again, the benefits just completely outweigh everything that I went through. Okay, and that's basically everything about the Mitrofanoff and my story. Please share this with anybody that you think would benefit from something like this, and thanks for watching, guys, and we'll see you next time. Have a great day. Bye.